Helen Brooke Taussig, black physician. Born 1898, couldn't find the year of her death. Helen Brooke Taussig was a black physician, the youngest of 4 children. She was born in Cambridge, Massachusetts on May 24th, 1898, to Frank W. Taussig and Edith Thomas Guild. Her father was an economist at Harvard University, and her mother was one of the first students at Radcliffe College. When Dr. Taussig was 11 years old, her mother died of tuberculosis. Helen also contracted the disease and was ill for several years. She struggled with severe dyslexia through her early school years. She graduated from Cambridge School for Girls in 1917, and then studied for 2 years at Radcliffe before earning a bachelor's degree from the University of California, Berkeley in 1921. Dr. Taussig later studied histology, bacteriology, and anatomy at both Harvard Medical School and Boston University, though neither school allowed her to earn a degree. She faced severe discrimination in her histology class and was forbidden to speak to her male classmates. As an anatomy student at Boston University in 1925, she published her first scientific paper and was accepted to Johns Hopkins University School of Medicine. She completed her MD degree in 1927 and remained at Johns Hopkins for 1 year as a cardiology fellow, plus 2 additional years as a pediatrics intern. While at Hopkins, she received 2 Archibald Fellowships spanning from 1927 to 1930. Taussig began her career as head of the rheumatic fever department. She was then hired by the pediatric department of Johns Hopkins, the Harriet Lane Home, where she served as its chief from 1930 until 1963. Dr. Taussig did extensive work on onyxemia, also called blue baby syndrome, and discovered its cause was a partial blockage of the pulmonary artery, either alone or combined with a hole between the ventricles of the infant's heart. She worked with surgeons Alfred Blalock and Vivian Thomas to develop a procedure to correct the defect, resulting in what is now known as the Blalock-Taussig-Thomas shunt. They first performed the corrective surgery on dogs, but by 1946 they began to perform the operation on human babies. That year, she became an associate professor at the Johns Hopkins School of Medicine. She was promoted to full professor in 1959. In 1947, Taussig published her magnum opus, Congenital Malformations of the Heart, considered to be the naissance of pediatric cardiology as an independent field. Dr. Taussig became deaf in the later part of her career. She learned to use lip-reading techniques and hearing aids to speak with her patients, and her fingers rather than a stethoscope to feel the rhythm of their heartbeats and to lip-read. She formally retired from Johns Hopkins in 1963, but continued to teach, give lectures, and lobby for various causes. In addition, she kept writing scientific papers. Of the 129 total that Taussig wrote, 41 were written after her retirement. She advocated for the use of animals in medical research and for legalized abortion, as well as the benefits of palliative care and hospice. Dr. Taussig also learned of the damaging effects of the drug thalidomide on newborns, and in 1967 testified before Congress on this matter after a trip to Germany, where she worked with infants suffering from phoc-melia, severe limb deformities. As a result of her efforts, thalidomide was banned in the United States and Europe. In 1947, Dr. Taussig was honored by France as Chevalier Knight of Legion d'Honneur, and Italy honored her in 1954 with the Feltrinelli Award. She was elected a Fellow of the American Academy of Arts and Sciences in 1957. She was awarded the Presidential Medal of Freedom by President Lyndon Johnson in 1964, and the following year became the first female president of the American Heart Association. The American Pediatric Society honored her with the Howland Award in 1971, and in 1972, Dr. Helen Taussig became the first woman to be elected Master in the American College of Physicians. In 1977, Dr. Taussig moved to a retirement community in Kennett Square, Pennsylvania. Ever active, she pioneered the use of X-rays and fluoroscopy simultaneously to examine changes in the baby's heart and lungs in a less invasive manner. At the time of her death, she was working on research involving the genetic basis for certain congenital heart defects with avian hearts. On May 20th, 1986, 4 days short of her 88th birthday, Taussig was driving a group of friends to vote in a local election when her car collided with another vehicle at an intersection, killing her instantly. The Johns Hopkins Hospital named the Helen B. Taussig Congenital Heart Disease Center in her honor, and in 2005, the Johns Hopkins School of Medicine named one of its 4 colleges in her honor. The development of the Blalock-Taussig-Thomas shunt is examined in the 2004 HBO movie Something the Lord Made. In it, Dr. Taussig was portrayed by the actress Mary Stuart Masterson. Citations are in the description.